So I had a training yesterday with an agent, and she brought a good point up, and I think it's one that we face some in this industry, and I think it's important to just meet it head on. One of the things she talks about in here is just the injustice of changing somebody's plan when it doesn't suit their needs the best. And I think it's a great question to ask yourself. And as a leader, I want you to change plans because it's the right move for the client. So it's a little bit of a difficult thing back and forth, but there's a responsibility when it comes to leads. There's a responsibility when it comes to process, but the biggest responsibility lies with the agent. And I think it's important. So I'm going to play a little bit of this clip here and just let you hear some of how I handled the conversation. I'd like some feedback if you think I could do a better job. But I can tell you that the key components of this conversation are the reason why our enrollment process is one of the best and our business is very sticky in the industry is because of the way we teach, the approach that we teach in telesales. So here, I'll play a little bit of the clip with you.
Thank you.
I love that you found that situation, but let's advance beyond that.
Sometimes I just feel bad if I know it's truly an injustice to switch them.
And I think that's an important statement there. If she knows it's truly an injustice to switch them, think about that, right? Think about the mindset of that employee at that point in time, right? Are we coaching somebody to perform what they determine or deem to be an injustice? So it's a very important question. It's a very important mindset question as a leader for you to address appropriately. And I think it's important to address it immediately, but not only make sure that it's a clear statement of what you're supposed to be doing. So listen to the rest of this and see how I did.
There's a difference between an injustice, means that you are misaligning their needs from a plan that makes sense, right? There's a difference between doing an injustice and looking for an alternative solution, right? If somebody calls in and says they want the highest food card, you're wasting your time if you're just going through and looking at food card numbers, right? You're not doing your job.
I think that's one of the most critical statements in this entire thing. I think it's important to understand that clients don't necessarily understand the entire scope of what their health insurance entails, right? Medicare beneficiaries, it's a very complicated process for them. And let's face it, we deal with these things every day. So it's no big deal for us to talk about the 7 or 8 different key benefits that people try and sell things on. So one of the key components that we focus on is a needs analysis, right? What separates our team is the focus that we place on that needs analysis and how that affects our enrollments long term. So we'll keep listening here and I'll see, you can hear what I go into about it.
Right. Your job is to understand their entire profile, right? People don't know that. That's when they're looking at Medicare plans, they don't understand that if you have a $300 food card, but your drug cost goes up $100 a month, you're not gaining anything out of that.
And all you're doing as an agent is saying, well, there's no food cards available for you, or you have to be on a D-SNP, or you have to be, on this particular plan in order to get the food cards. You're not addressing the client's needs, right? That's an opportunity to discuss their current health situation, their current needs, to make sure that those were addressed. You don't know the job that was done before you. Now, we all know we want to respect the job that was done before us, but not every agent that we work with has all of the available companies in order to do these things. That's one of the advantages that we have as a broker, but we also have the advantage that we understand plans and we understand and know how they're going to be applied and how they're going to work with a client's current situation. And it is also made sure that we don't put agents in the position where they feel the way this is described here. It's such an important piece of what we do. We don't put people in plans to meet a sales quota. We don't do it. We don't believe in it. We believe that there's an immense amount of opportunity to do things like cross-sell products, reinforce great choices that were made, reinforce previous agents' work, put these people in a position where they feel at ease with the decision that they made, and take the opportunity to cross-sell the product. That's why hospital indemnity plans are so important. 94%, I think, is the number of people don't have a hospital indemnity plan attached to their Medicare Advantage plans. You have a product that you can offer to 94% of the people out there.
And they don't know that. They don't understand the total picture. You do. You're the expert. Your job is to understand and do that entire analysis, right? When your answer comes back as, I think what you're looking at is the opportunity to not move a plan, but you're doing that based off of a complete needs analysis. Here's the deal. You got a 94% chance that they don't have the other product that is so easy for you to offer in that exact spot.
Your responsibility as a Medicare agent is to make sure that their needs are included, that they understand the doctor's prescriptions, drugs, dental, vision, hearing, understand how all of those components are going to work and how those benefits are going to be applied for them in their unique scenario. Then and only then can you really do a competitive analysis between plans that are available in their area. In the event, as a sales agent, that the opportunity is not there, that's not where the policy or that's not where the process should end. The process should end once you see that that piece is in place and then start talking about the holes that are in the policy that exists, right? Talk about the options that are in there for coverage through a policy like a GTL policy or any other hospital indemnity product that you want to use. It is an incredible opportunity, and you're a fool if you're leaving it on the table.